Hello everyone, just making a follow-up video to my treatment for the squamous cell carcinoma, HPV related. It was a throat tumor, base of the tongue. If you watched all my other videos, you know pretty much where I was throughout my treatment. Today is actually October the 16th, 2024. My treatment ended September 21st of 23. So we're a little bit over a year since my last treatment. And I just want to let you know where I stand. All the pain that I had related to the tumor in my throat subsided probably about February into March, and then April, May, June, I was pretty good. My taste came back, I would probably say about 80% to that point. Right now my taste is just about 100% again. I'm very fortunate for that, because I know there's a lot of people out there that say that years later, they still don't have their taste back in its entirety. And everything just about tastes normal. I had problems with chocolate for the longest time, but now it tastes pretty much normal. As I said, the pain in my throat is gone. I'm not going to say that my throat's not the same, let's put it that way, as it used to be. I can still feel, I don't know if it's scar tissue or whatever at the tumor site, but it's not painful. That pain that I had raising up into my head and the nerve, all that is all gone. I will say I do have stiffness in both sides of the back of my neck, and even under in here. It almost feels on an hourly basis that I have to stretch it out, and I can feel that the muscles in there are no longer the same. They do cramp up, especially on this side. I get cramping. Never had it like as bad as it is now, before my treatment. But my tongue, again, I stretch it out. It does feel a little different back where the tumor was at the base of the tongue. But if I try to force my tongue against the roof of my mouth and push on my tooth, for instance, it will cramp up on that side where the tumor was. It's strange, but it's nothing horrible. I just try not to push on my teeth with my tongue. Weight-wise, I gained just about all of my weight back again. Roughly, probably about 32 pounds I gained back from my lowest point. So I've been pretty healthy. I try to eat better than I did prior to this. I pretty much cut out alcohol completely. I'm basically 4 years sober. If I have something, it's like a White Claw or a Mike's Hard, but not several. If anything, I have one or two occasionally, and really it's not often. I've cut down on red meat. I barely eat it. I started drinking coffee again, and I'm solely on decaf coffee, whereas I used to drink full caffeinated coffee. But I will say I probably if I have one drawback, I probably use too much sugar and cream. I probably drink 3 coffees a day, 4 coffees a day, 12-ounce cups. And at that point, I'm working on it. I'm going to reduce the amount of sugar I use. And I've been trying to eat healthier. One thing I still do, and I don't know if I'm just addicted to it or what, but in the beginning, the one thing that tasted good to me right after my treatment was peanut butter and jelly on toast, white toast. And even directly after my treatment, I would have a cup of green tea with honey in it, and I would dunk the peanut butter and jelly toast into the tea to soften it so it wouldn't hurt my throat when it was going down. And I got, if you eat 4 of those a day, 4 pieces of peanut butter and jelly toast a day, with, say, just about 2 tablespoons of peanut butter, that is going to get you close to 1,000 to 1,100 calories a day in just that one meal. And since I was trying to get high protein diet and I was trying to increase my weight, I basically ate it every day, and I almost every day still eat it every day. It still tastes good to me. It's packed with protein. So I pretty much eat it just about every day, and try and balance it out a little bit. I throw some eggs in here and there, and pancakes. But nevertheless, I've just to reiterate, I'm trying to eat a better diet, cut out the bad things. As I had said in my previous videos, I quit chewing tobacco. I no longer, and I never will, chew tobacco again. I'm doing everything I possibly can to keep myself going in the right direction, so that I have a better chance of living a better life without having to go through something like I just went through. I'm 55 now, and I know that's not going to last forever, but I will do the best I can to try and stay healthy. On the exercise front, I was exercising 3 days a week, and I probably started a little bit more aggressive than I should have, and I ended up with injuries. So I had to stop and start again. And then about 6-8 weeks ago, my tendonitis in my right arm got really bad, and I just needed to take a break. So I just stopped all of my exercising. Well, not all of it. I mean, I still go try and take the dog for a walk a few times a week, and I'll walk a mile a day. So that's a little bit there. But my knee was hurting me. It was swollen from working out too much, and my tendonitis kicked in. So I just couldn't work out. I needed to just give my body a break after what it's been through. I know exercising will help in the healing process and help you to recover quicker. But I think I just needed a break. So I've been off now for about 6 weeks, and I plan on getting back to it soon. The tendonitis feels much better after the rest. I couldn't even lift up a cup of coffee with my right arm. That's how bad it got. So as far as the exercising goes, I put that on hold, but I do plan on getting back to it a little bit more aggressive than I was before. As far as my doctor's appointments and updates on my status. In January, I had an MRI of my throat. I was supposed to have a CAT scan of my chest because originally they had discovered nodules on one of the lobes of my lung, and my insurance company wouldn't pay for it for whatever reason. So we got the MRI of the throat, and it came back, tumor's gone, no sign of cancer. My oncologist wanted to do what they call a NAVDAX test, and I believe it's NAVDAX. NAVDX or DAX, I'm not sure. But what that is a DNA test. And they take your blood and they ship it to a lab. And the lab actually tests for, I guess what it is the markers for cancer anywhere in the body. And it can detect cancer up to 4 months, cancer, a reoccurrence of cancer up to 4 months in advance. Before a scan, it could test it before a scan could even detect it. So at that point, my oncologist feels that that's a better indicator to find evidence of a reoccurrence. So in January, that came back, no signs of disease. So that was a good thing. I felt pretty good, but as time went on, I got better. And as I said, by June, I was due for my next appointment. So on June 27th, I went back down to have another MRI of my throat, and they did do a CAT scan of my chest this time, and they both came back good. They still see nodules on my lung, but they're not worried about them. They haven't grown. From what I understand, a lot of people have nodules on their lung, and it's nothing to be concerned with. But we're going to monitor. As far as the NAVDAX test, they gave me again in June, and that also came back as no sign of disease. So I've been doing really well. And as I said, today is October the 16th, and I had a appointment with my cardiologist today. I literally just got out of the appointment, and the reason I went to see a cardiologist, I really have never had heart trouble before. I had a few episodes where I thought I had heart problems, and I think that was related to dehydration and binge drinking wine on the weekends, and dehydrating myself, and overworking, and not sleeping. I mean, let's put it that way. It was my own fault for feeling that way. So anyway, my oncologist referred me to a cardiologist because chemo and radiation can cause problems with your heart, and especially with your carotid arteries. There is concern there when you have radiation and you have chemotherapy, and the chemotherapy can also cause problems with your heart. So ultimately, they had told me, in the future you're going to need to see a cardiologist. So I made the appointment, and I just went in and see the cardiologist. He's one of the top cardiologists in the Philadelphia area, and they did an EKG. They checked my blood pressure. They checked my blood pressure sitting down and standing up, because I had mentioned to them, I don't know if I mentioned it in the previous videos, when I did come home from the hospital, and I was home for a while, I had an episode where I bent down to get something. I knelt down on the floor, and I went to stand up, and I passed out. The next thing I remember is I woke up, and I had blood gushing down my face, and my dog was actually licking my face. That's how I woke up. I don't remember falling. I just remember standing up, getting almost like a blackout condition, a whiteout, I guess you could say. And then my ears started ringing, and that's the last thing I remember. And the next thing I knew, I was on the floor. I had lacerated my face, my forehead. I still have a scar there. But I passed out, probably because I got up too fast, and I was worried about my blood pressure at that point. But I think, again, it was after my treatment, and I probably didn't drink enough water. And as I have told you in the past, the chemo beat me up pretty good. Even low dose chemo, it beat me up pretty good. And that was with cisplatin. And that's why we ended my treatments at 5. I was supposed to get 7, but we ended them at 5. And that's where my oncologist wanted me to at least get to, was the 5 treatments, because that's where all the trials were. And 7 would have been better in their opinion, but 5 got us to where we needed to be. So anyway, my oncologist recommended that I see a cardiologist to make sure there's no damage to the heart, no damage to my carotids. So I met with this doctor today, and they did an EKG. They did my blood pressure, as I said, my pulse ox, and they actually did a ultrasound of my heart right in the office. It's pretty neat. They showed me it, and he asked me what I do for a living, and I told him I'm a mechanic. I fix cars. And he said, "What kind of cars you fix?" I said, "All kinds of cars." He said, "Well, you know what this is?" He said, "This is like someone bringing a showroom car to you that was pulled right out of the showroom and wanted you to fix it." He basically told me that I'm fine. I'm perfectly fine. The only thing he wants me to do is to get my carotids ultrasound. They couldn't do that in the office. I have had it done before, a few years ago, well, several years ago, probably like 5 years ago. And so he said that that's a good baseline to start with. But he basically told me my heart's good, everything is good. Continue what I'm doing. Pick up where I left off with the exercising. Try to control the amount of sugar intake I get. Maybe increase the amount of fish that I've been eating, because I haven't been eating enough. Increase the fruits and vegetables, which everybody knows that's what they say is good for you. So it was a good meet with the doctor today. I go back in December. I go back December the 3rd. That's my next doctor's appointment. And that will be with my oncologist, and that will be for an MRI, to make sure I'm still going in the right direction. Every indication is that I am. Every indication is that the cancer is gone, and I'm just hoping it stays away. I'm doing everything I can to try and make that happen. So I'm happy to report that, after my 35 radiation treatments and my 5 chemotherapy treatments, at least up to now, a year and almost a month to the day that my treatment ended, I'm good. And I can't thank my doctors enough, and everybody at the hospital. And I spoke to a doctor who is a friend of mine, and he gave it to me straight last year. He said the next 2 years of your life are going to be the important ones, because of the amount of blood vessels in that area and the risk of spread and the risk of reoccurrence. So I need to stay on the right path and keep praying, and all will be well. I am, as I said, I'm almost back to my original weight. I'm working 10 to 12 hours a day, as I did before, and it's one of the reasons why I haven't been able to make a video in a long time. I had an issue in the earlier part of this year, and I actually had a growth on my ear, and I had one 2 years ago on the other ear, and I went to a dermatologist, and they said, okay, well, we're going to remove it and we're going to test it just to make sure it's okay. And this is prior to my cancer diagnosis. And they cut it off and they biopsied it, and they said everything was good. It's, benign, nothing to worry about. So then when I got done with treatment and I came home, I think it was like in May, I had another growth starting on this ear. It didn't go away. It was just right on the inner lap of my ear. Now, I was taking a shower and I could feel it. So I said, okay, I better go see a dermatologist and get this one removed too. So I did. And this one they removed. And while they took this one off, but they also wanted to take a biopsy of my back because they saw moles back there. So they biopsied that, and they biopsied this, and it came back as squamous cell carcinoma. So basically it's skin cancer. And the one on my back came back fine. It's just the one on my ear was cancerous. So they scheduled me with a surgeon to take margins around that to make sure it was not, deeper into the epidermis. And I went and I had that done in June. And when they removed that, it came back fine. It was not down into the lower levels of my skin. So as they removed it, that's I had to deal with that scar, or the scarring on my ear, and between work and that, and just generally trying to keep myself going in the right direction, and just life in general, I haven't had a chance to make this video. But I wanted to reach out to you guys and give you, encouragement, and tell you that if you are out there, if someone you know is going through this, to watch my other videos if you need information as to what happened to me, at least, and how I dealt with it, and right up into where I am today. I just want you to know that it's doable. You can get through it, and you can get to where you are now, or where I am now. It's going to take time. It's not a fun process, and I will always have the fear of it coming back, but I'm going to do everything I can to make that so that it doesn't come back. And that's all I can control. And if it does come back, then we fight again. But I don't think there was anything else that I had. Oh, I did want to say one other thing. Another reason that I didn't make a video in a while was when I did get done with treatment, I had more questions myself that I wanted to try and get answers to from people that had gone through this. So I couldn't find any more good videos on YouTube. So what I decided to do was I went to Facebook, and I found a head and neck cancer support group on Facebook, and you had to be accepted into the group. And I just wanted to get information, where am I going from here? What's going to happen next? How many people survived this and everything else? So I did, and I signed up for it, got accepted, I went on in the group. And I was going on it almost every day. I will encourage you to do that if you need information, or you want to share information with someone. It is a great platform to share knowledge, but I will also caution you that some of the things that you're going to see, read, and hear on there are scary, and they can play with your mind. Not the people on there, just the thought process of it can play with your mind. There's a lot of good, positive stuff on there, and there's a lot of sad, negative stuff on there. And it's not intentional, it's just the way it is. People share things that they're going through, and it's not all good. So if you do go to a site like that, be prepared, know when to turn your head, and you don't want to get psychologically caught up in negative knowledge, because it could be detrimental to you. But I did go on there for a while, and some of the people who had messaged me and asked me questions, I noticed that they were on there also, and I didn't tell them about it, but they found their way there. But it's a good resource to find out information. It's a good resource, to share what you're going through, and to, encourage others. It's just, I'm going to give you a for instance. It's horrible to hear someone talk about a reoccurrence that they're going through when you're afraid, or you're thinking about, can this ever come back? And that's something that, you want to stay positive, and you can send your prayers to those people, but you still need to be positive. Treat yourself as your own person. Just because it happened to someone else doesn't mean it's going to happen to you. But that's a great resource, as I said. If you need to get information, the information about, like what I was telling you about, everything that I went through, and things that I used, like that salve for my throat, the drugs that I was taking, that they had me on for the nerve pain and so on and so forth. A lot of that stuff they share on that website, on that group, and it's well worth diving into it and sharing. It helps. It can encourage. There's a lot of encouraging people on there. Don't get me wrong. It's not all negative vibes. There's a lot of encouraging people on there, and they're helpful. And God bless them too. As I said, anybody that goes through cancer of any sort is, they're all warriors. We're all warriors. It doesn't matter if you're a little kid or a senior or anywhere in between. Cancer is a battle. So you have to be a warrior. And I guess that's about it, guys. I thank you guys for watching my videos. Again, I never did them for me. I did them for you guys, and for anybody that has questions. I will try again in the future to update. I'm ecstatic to be where I'm at now in my cancer treatments, in the health that I'm at now. One more thing that I did forget about the exercise stuff. Since I stopped my workouts and my cardio, I was running on the treadmill, and I do a dumbbell workout with basically combination cardio and strength training. But I was doing it 3 days a week, about an hour a day, between the running and the cardio and the weight training. But since I stopped, because of the tendonitis and the knee pain, the one thing that I have been doing to try and get myself back to where I need to be is stretching. I cannot emphasize the amount of flexibility that I lost over the years. I was very athletic at one point, and then from being laid up for as long as I was, the my muscles were just so tight. That can injure you when you try to work out. But I try to stretch out every single morning now. I stretch for about 15 or 20 minutes every single morning. Just about every area of my body I stretch. My hands, my forearms, my shoulders, my chest, my back, my legs, my feet, my ankles. I stretch everything. Over time, if you do that consistently, and you can start out slow, you can find stretching videos on YouTube. You can find stretching videos probably just about anywhere. And even a yoga class would be great if you're interested in something like that and you have the time to do it. But stretching out your muscles is probably one of the best thing I can recommend to you, whether you have cancer or you don't. As we age, everything gets tight. And when everything gets tight, you can just move the wrong way, and the next day you can't walk, and you're wondering why. So work on flexibility. I'm telling you, you'll thank yourself, and you'll be a happier person for it. But it has to be consistent. You need to do it on a daily basis. Just set aside 15 to 20 minutes every single day to try and stretch. And I'm telling you, you'll be a happier person. You'll feel better. So I've been trying to do that to get myself back in the position where when I do start my training again, and my cardio and my weight training, I won't get hurt as much. I'll limit the possibilities, but yeah, that's very important. But again, all right, guys, that's it. I gotta wrap this video up. I gotta get back home and get back to work. If you guys have any questions, feel free to hit me up in comments. I'd be happy to answer any questions that I can for you. If you have questions about that NAVDAX test, I don't know if they have that all around the country or all around the world, or if it's something new that my oncologist in University of Pennsylvania hospital is doing. I don't know, but I'm encouraged by it. It's a great thing. And again, I will try to post another video perhaps by the end of the year to let you know how my December MRI goes, and let you know how I'm feeling. We'll go from there. Okay? All right. Anybody out there that's going through cancer, any form, God bless you. And I mean that. I pray for you. I pray for everyone that has it. I've lost a lot of people to it, friends and family. Almost lost myself. Be a warrior and find a good hospital. Get good treatment. Watch my videos. If you have any questions, let me know. Amen. God bless you. Peace out. Till next time.